Okay, and let me get my sound on here, make sure I'm good. And you should be able to hear me now. I'm, as usual, I'm getting started a little bit early, and whatever anyone might miss who comes in at 11 or a little bit later, that's no problem. It's here on the recording. We have a fairly busy week, and we have, let me just kind of run through the agenda of what we have going on. Today, of course, is the 5th, and we're going to just review Leisure, that case, and then we'll move on to look at the county case, okay? And then we'll move on to two other cases, and probably this will happen on Wednesday. Two cases that are going to be due, Foster, okay, and Gorman. And very quickly, here's Leisure is a load balancing case, and we're going to, of course, move on that. Hi, glad to have you here. And you can always double back and see. I just got started about a minute or two ago. But anyway, the Leisure Airlines, and we've got, and I have some destinations there that you can paste into the easy map maker. So we want to take a look at that so you kind of get a feeling of who they are and what they are. And I have some resources up here that show you their airports and some information about geographic dispersion and low-cost airlines, and so those are related to the Leisure case. And then I have I think this is about the airliner they use, the Boeing 737-400. And then here's some information you may want to take a look at. Of course, this case deals with revenue management and how airlines decide what you pay. Again, these are resources I've got for you, and then we're going to move on. And probably we'll get started on it today, and then we'll probably and then we'll work on it again on Wednesday. Will be the county case, which is over on pages 215 to 223. Okay, that's county, and the county uses a technique known as data envelopment analysis. And we'll talk about that. And what that process is a way by which we can compare different operations, okay, at different sites. And so the DEA lets us build a model, and then we can, it's an efficiency model and it's a systems model, and lets us look at, and we build a model, then compare actual operations against it, okay? Well, I want to get started first of all with the Leisure, okay? And pop up here, and I'm going to show you the Leisure key. And I'm going to download it, and then we'll just take a look at it very quickly in terms of what we had to do. But Leisure is a revenue management problem, and then, like I said, when we work on county, the county, which is pages 215 to 223, if I'm not mistaken. Yeah, that's the county program problem deals with what we call data envelopment analysis. Now, Leisure key is, again, one of these typical cases where I ask you to change some variables and then see what you get. And in this case, I ask you to go ahead and for each of the legs, raise the fare, leg 1, raise the fare 10%, okay, and then reduce the fare 10% and raise demand 10%. Then on leg 2, okay, to decrease the fare 7% and increase it by 11, okay, and then on leg 3 to increase the fare by 6%, no change assumed in demand. And so I have over here also a little assumptions area, changes in fare, changes in demand, okay? Now, what we're looking at right here, again, is we're assuming, all right, that the pricing for airline tickets is what we would call a variably good. In other words, as fares go up, demand goes down. That's not always true, and it doesn't always follow that pattern, but that's a fairly good assumption. Also because airlines, we've talked about this before, are so heavily tilted towards fixed costs. Okay, and we've talked about that before. Is if I'm going to fly from Oklahoma City to Dallas, at a certain point, it doesn't matter if I've got 150 passengers or 50, I'm still going between, and the fixed costs are such, I'm going to be where I'm at. The issue is, can I get enough margin on my variable costs to be sustainable? So I ask you to go ahead and input those data, all right? And what we're trying to do is get the maximum revenue. Now the textbook, and we'll go back over here for just a second, talks about revenue management systems, and I think, if I'm not mistaken, they give you an example, okay, over American Airlines. They are the first people to utilize this approach through what they call the SABRE method. And of course, then they talk about there are a whole different hosts of companies. Almost everybody now that has who's involved in multiple locations, especially those in airlines or transportation or logistics, utilize a revenue management system, okay? And so we start to get some information over here about leisure and what they do, okay? And we'll flip over here, and you can see the model, okay? This is a schematic model of how Leisure Airlines operates. What they do is they collect passengers at these two terminals, Pittsburgh and Newark. They funnel them into Charlotte, and then they funnel them out to Orlando or to Myrtle Beach. That's where they fly. So they've got, basically, they use a hub system, although it's really more like a faucet or a funnel, where these passengers are coming in, okay, and then we pop them on out. And I would assume they probably have some layovers involved so they can build a passenger base. They probably run 2 or 3 of these flights. But notice again, they're headed in and then out. There's no flights between these as well. Now, what I asked you to do was to go ahead and use these assumptions, all right, and then look and then try to find, and then to find out, okay, what the maximum revenue would be. Now, the mathematical model for all this is over there in the text, okay? And we'll take a look at that for just a second. Okay? And here it is. The origin and the forecasted demand, excuse me, okay? And the ODIF, that's the origin, destination, itinerary fares. That's what they're charged. And then the forecasted demand, and that's what they're working from. So we start to see, first of all, a data table, okay? And above that, of course, the conceptualization of how they operate, and that is their transportation nodes, okay? Now, here we start to build a linear programming model. We start to subject this thing to a mathematical model. And again, this is why these are such powerful and useful tools, because we can begin to build mathematically what we want to see happen in the real world. And we know while it won't be exact, we can get awfully, awfully close. And that's okay, because we know there's going to be a range of outcomes, and we want to be within the range that makes sense. And so here is the objective function, okay? Then we start to work through capacity constraints, okay? And then some demand constraints. And then here's the whole thing. Here's the objective function, okay? And again, it's linear algebra. It's what it is. So we assign values to each of these variables, and that's those flights. And then we have subject to these demand, the capacity constraints and the demand constraints. And then we go and get the optimal solution. I'm going to pop this over here for a minute, and they're going to show us this. Here's the objective value. And again, this uses that lingo, okay? And what they're telling here down here in terms of the slack or surplus, we have some surplus here or slack here, and as well as here. And we can increase our value that is for each change in one of these constraints. If we lower it, we can get a dual value. We can increase it by 4 units. Now, I'd ask you to look at some of these variables and say, okay, what if we operated under these demand schedules? So I'm going to click over here on data, And I'll come over to Solver, and we'll take a look at the Solver dialog box, and there's the objective function, okay? And then we want to maximize the revenue, all right? And again, this differs from the book because what I asked you to do was to change some of those decision variables, okay? And then we have the constraints down here. And we assumed a simplex LP, and then we just solved it. Now, that's the basic work with leg 1. And then I did some work with leg 2. Okay? Okay, and now I'll close this off. Let's be on a single cell. Okay. All right. I've got it. Close down, please. Thank you. What are you doing here? All right. Single cell on the active sheet. All right, I need to be on the active sheet. Go back here to the model. There we are. Now I'll close that and hopefully that weird. Well, it's not going to be cooperative today, but if you work over on the leg here, and I'm getting this. We should get some different values here. Well, okay. It's just going to let us work right through them. And you can see here on the leg 2, if we do that, if we follow through on leg 2, okay, and we use those and we maximize revenue, you can see how we do. Here we are on leg 1. Okay, so we do a little bit better with 2. And then we look at leg 3, okay, and we assume a change in the fare with no change in demand. So what it looks like at this point, is we could simply take that third option, change the fare on leg 3, leave the demand the same, and leave capacities the same, and we're in good shape. Okay? Now, we'll click on the model, and of course, that's the whole starting point for this, where we're at that maximized revenue. But again, now, let me go back here. And if we go back to, all right, you're not giving me nice today. I don't want to miss this for a second. Here. Okay, I'm going to close that off. If it's going to close. Hey, it's Monday. All righty. Now, let's see if I'm going to be able to hold you, get that down there. That is strange. Hang on a sec. All right. Oh, Excel's being nice today. Okay, maybe we're good there. Now, as you can see, the original revenue, and we've improved on it by trying some of these changes here. Okay. And I'm going to get rid of this if I possibly can. There. Now, because of Task Manager. Now, we've got a couple of other cases here, and that's the leisure key. Now, we've got a couple of other cases here, actually 3 of them, and we're going to talk about this week. And we're going to look at the county case, and then Foster, and then Gorman. So we're kind of moving along, okay, in terms of a little bit different types of problems. And the problem we're going to be dealing with, we'll move back down here. All right. With leisure, we really dealt with a load balancing problem, even though we were maximizing revenue. We've had some other cases where we maximized costs. And in county, we're going to use a process known as the data envelopment process. Now, walk over here for I believe it starts at 2:15. In data envelopment analysis, and here's just basically the model. What we do is we will have multiple parts of a system, say franchisees, or in this case, 4 different hospitals. And what we do is we build a composite based on them, okay? And then we compare each of these against the composite. This is not, in the most simplistic terms, it's not too different than if I take a set of data that has 4 data points. I compute the mean and the standard deviation, maybe, and then I check to see how far each of these are from those summarized values. And the composite assumes we do a test of each of these to see if this general or university or county or state, if they are more or less efficient than the composite, okay? So so we use the linear algebra to do that. And as they talk about here in the textbook, that we build an efficiency index, okay? And this is a very, very widely used model, although at times there are going to be some issues or questions about inputs. And as you can see, you're after the minimum values. Let me pop back here a little bit more so we can kind of get started with it and see what we're talking about, all right? And you'll see this technique is used a lot. And they give you a little blurb here about DEA and the banking business, people using them. We'll move over to this case. Now here we're going to evaluate the performance of some hospitals, and there are these 4 hospitals: General Hospital, United Hospital, County, and State. Okay, and we're going to use the DEA, and so we have two sets of things we put together. First, the input measure, and the second then would be the output measures. Now this works on the assumption, okay, that systems like a set of hospitals that are all united, or franchises that are all under the same the same brand, whatever, that they should act the same. If you owned a franchise, the people who have that franchise, especially the larger ones or well-established ones, they have a particular way everything is done because they know what it takes to be successful, and so they have everything programmed out, okay? Now, in these hospitals, they've got some input measures and some output measures, and they're starting here, first of all, with the number of full-time equivalent non-physician personnel, okay? And these are going to be support staff and people like that. And then the amount of money spent on supplies, which is a variable expense for sure, and the number of bed days available. Not all of these hospitals will have the same number of bed days, right? And we don't get too much information on how those are computed. But the input measures that you see here, the authors are summarizing this for you. But when you do a data envelopment analysis, you do the DEA, you really have to do a lot of work in terms of what you're going to come up with as regards the input measures, okay? These input measures work for these hospitals. St. Anthony's may have their own set. Who knows? You just have to go in, but I'm sure they use it. As I've had health care provided by what used to be Shawnee Regional Hospital, it's been interesting to see how things change and how things are done. Now, some output measures are these. They have the patient days of service under Medicare, patient days of service not under Medicare, and then the number of nurses trained and the number of interns trained. Okay, let's talk about those for just a moment. The patients under Medicare are those people who qualify, okay, for Medicare, okay, and that's different than if someone qualifies for Medicaid, that's an income-driven kind of thing. Medicare is more of an age entitlement, okay, and so they want to know how many people do we have under Medicare, and the reason is pretty simple. Doctors and hospitals in their billing practices have a lot more rigorous system to face when they deal with the federal government or the state and federal government than they do with, with an insurance company or insurance companies. Okay, and part of all this issue is you've heard this debate, national debate about the Affordable Care Act and all that business, and this whole idea of the premiums that people have to pay, etc., really gets driven by who subsidizes this or who pays for the care. Now, they're going to also be interested then in the people who are in regular insurance, okay, or those people who are self-insured, okay. Both of my parents were self-insured. They didn't have insurance, and they didn't pay and they didn't use Medicare. They were well off enough to pay for themselves, and that's what they did. Now, the number of nurses trained is important because that facility will get reimbursed for nurses being trained. The nurses do intensive internship and field training. They have to. And then the number of interns, those are, of course, doctors in the making. Okay, and again, this is a reimbursement issue. This is an output, and they want to see how well they do at that. So they give us some of an overview of it, and they talk about a hypothetical composite. Okay, now it's a really fancy way for saying something that looks like everybody ought to look. Okay, which is the same idea of central tendency, and that is the mean, median, mode. Okay. And then we take that measure of central tendency and we want to see how much stuff differs from it, how much variation there is. Okay, if everybody comes in, and I don't keep track of the standardized testing for students for college. I don't know. Yes, if somebody comes in, I don't know. I'm going to throw out a figure. A 24, 23. Okay, pretty good. If someone comes with a 29 or 30, I guess you could score that. That's pretty good. Okay, and so that's a person who's an outlier, and you may have outliers in the other direction as well. So we want to look at these, okay, and see how well they fit versus a composite. Now, there's one of the problems with this approach, okay, and that is there's some assumptions here, and you always have to be thinking about that, of what we call equifinality. The idea that I can take inputs in any situation, a set of inputs, and get the same outputs regardless of location or wherever. It just doesn't work like that. There's always going to be variation, okay? Let's take Chick-fil-A. Chick-fil-A, they make fries. They have a certain way the fries are being made, certain oils. They buy the potatoes from somebody. I'm certain they're all cut up. They're not sliced up there. And then they have to be cooked a certain amount of time, and they have to have a certain temperature. There's going to be variation between that. The question is, you don't want to have the fries that are so hot that a person sits down and they can't eat them, or they're cold and they're rubbery. You want to be within a band, some band where a person goes, oh, okay, that's acceptable. All right. So here we're assuming that we can get equifinality of inputs or something that approximates that. Okay. And there's just no way to tell. You can take 25 human beings, all right, put them through basics at Camp Pendleton or down in Carolina, and when they come out, and if they're put into those same 25 people are all together and they're put into a hostile situation, I can tell you the statistics are that 1/3 of them will never discharge their weapons. Human beings freeze when it becomes life or death. And yet these are the most well-trained warriors in the world. But I can guarantee you 1/3 of them will never discharge their weapon. Some will hide, some will hold back. You never know, okay? And so, so the idea of equifinality of inputs, but you want it to be around a certain level of variability, okay? Now, as they walk us through here, they're going to start to show us how these composites are put together. And so and I'm spending this time, and I apologize, it's a little more didactic than usual, but the bottom line is this. as you're putting that composite together, there has to be a tremendous amount of thought on what those output measures should be, as well as the input measures. Okay, and so they're walking through the Medicare patient days, and for each hospital. Okay, and then they put that into an equation, and that gives us the output model. And you can see the relationship between the output measures, and they show you this here in figure 5.1. Okay, and you can see that each of them have some variability. If you look, for example, let's just talk about Medicare. If you look at the general hospital, okay, and this is over on page what? 218, excuse me. You're going to see that there's a variation there of about 5 persons, or 5%. The non-Medicare in university, that's a little bit wider gap. You've got a gap of 7 units. When you come over to county, you've got a gap of about 9 units the other way. And then when you look at state hospital, you have a tremendous variation between non-Medicare and Medicare. Why is that? Well, it's simple. The state hospital serves a different type of clientele, okay, than do the others, measurably so. And I can just look at these, and I can look for these variances and see. Now, we're going to run them through the, we'll run them through the blender and see how it all comes up. But this is how we get the composites built. Then we can look at the nurses, and you can see there's some pretty good variation here. 253 versus 148. And then the interns, same story. Okay. Now, this is where they get the composite for those output measures. It's pulled from each of those. It's built as a linear equation. You can have as many of these as you want. If you have 100 hospitals, the composite can have 100. If you have 1,000, you can have 1,000. The method is pretty robust because the methodology is robust. Okay. Now I'm gonna pop over here for just a second, and we can look at the output constraints that we build from those. Same thing as we go through non-Medicare, nurses and inputs, nurses and interns. Okay. So we have the inputs, and what we say is the input for the composite hospital must be equal to or less than the resources available to the composite hospital. Okay? This guy, and we're talking about the idea of equifinality. Then we build this, okay? And we have the input measures for them. And then we start to talk about the efficiency index, which is the fraction of the county's hospital input available to it that's used. And they start to see, it's important to really take the care to go through a schematic like this, to take a look at it and make for sure, 1, do we have the right input and output measures? 2, are they accurate? Okay. And again, they've gone through a process of deciding that and figuring those issues out and then getting those measures. This is a set of hospitals. And then you come down, you see the composite. You can see the physicians, number of physicians, supply expense, bed days. And you can see as you work down, and you can work across as well, comparing supply expenses and bed days. Now the bed days are going to be critical. And the reason is because bed days, that represents billing. The supply expenses are, those are intuitively easy to see. It's the bed days. How many bed days do I bill them for, plus any other associated tests, things of that nature. And that's really, as they work through it, we begin to try to build an efficiency index, okay? And here you see the test. If the efficiency index for a location equals 1, then it requires as much input as the county hospital does. And it says, okay, we're okay. Okay. Then if it's less, it requires less input to obtain that output. Okay. And so we judge it on the inputs, less or more, and make a decision on how efficient it is. And then we have the constraint part. We have the objective function, the E, and then we have all the constraints that are built in. Again, as I've said before, so many of these models, excuse me, are exceptionally versatile. The DEA is used by banks, it's used by hospitals, it's used by franchising operations. Anywhere where I have multiple locations and I want to standardize things as much as possible so I get a low range of variability. The reason that Americans eat so much fast food is very simple. Number one, you don't have to fix it. You go there and you buy it. Number two, the quality control on that is so tight that if you eat at Chick-fil-A in Shawnee, it's about the same as, or it tastes like the same as Chick-fil-A in Oklahoma City or anywhere else. So you don't get any regional differences or anything of that nature. Now, really the people who pioneered it even before McDonald's would be a company called, and they have been around a long time, a company called Howard. Well, I guess there are some left, Howard Johnson's. And they located themselves out on the interstate system as it was being built. And Howard Johnson's made sure that they sold gifts and stuff like that, but they also had a place you could sit down, buy hamburger, a malt, this or that. And usually they'd link up and they have a gas station next door. But they understood that if people could get the same experience at every Hojo, then they're not going to drive into town and eat at the local restaurant because things will be so variable. Okay. And, if you're not from there, you don't know where to eat. Now, you don't worry about that. And I remember my parents, before franchising and all that, I remember my parents would go on a road trip. They kept notebooks on, where to eat and where not to eat, who was fast, who was slow, who's good, etc. Well, they walk us through the solution for all of this, okay? And we'll talk some more about that, but that's really the summary of that approach, and we have some infinite decreases we can make, and we'll talk some more about what we're looking there here in the week. Okay, now there are a couple of other cases that we've got due this week, and both of those cases deal with transportation problems, and one of them is Foster, okay, and the other is Gorman. Now I'm going to go back. I'll go over here for a moment. And let's see, the Foster, I think I had 308 to 310. I think they're in chapter 6. So we'll find out chapter 6. And, all right. And, let's see, I wanted 308 to 310. That's the Foster, if I'm not mistaken. Yep, let me go back here. Now there's some background information about Foster, but this is a good way to just kind of introduce it, and then we'll climb into it with a lot more specificity on Wednesday. This is a transportation problem. Now, when we talk about transportation problems, okay, or what we call network problems, they really involve one of two things, sometimes both. One of them is location to location, i.e., for example, in this case, I send stuff from a plant in Cleveland to a distribution center in Boston, okay? And they're going to use some terms like nodes, origin nodes, and destination nodes. That's one type of problem. Now, when we go and we look at Gorman, that's a whole different type of problem because that's a shortest route problem, okay? And so that makes it a little bit different. Now, again, we're going to be using some of the general linear. We're going to use the linear method to deal with these. Okay? And we'll see some of the that solution, okay, for them. Let me pop over to 310 and through 8 to 310. Take me a little bit of time to do that, but that's okay. And maybe if I go down here to shortest route problems, and now, as you go through these cases, there are several of them in here, and what I tried to do is select the ones that I thought that would give us, you know, the most generic type of look. And I went 308 to 310. I think I'm pretty sure about that. I haven't mastered completely the art of navigating through my online text, so that's on me to do. Yeah, it's Foster generators. Yep, I'm right. 308. My apologies. Get over here real quickly. The search function in this too could be improved, but okay. This is a company, okay, that they make generators, okay, and we're trying to figure out how do we arrange their distributional node. Now they're showing you the Excel solution for that, okay, and I can't remember. I think I might ask you to change some of the variables, but let's talk about this for just a few minutes and take a look at it. Now, here we have a situation again. This is a transportation issue where we're looking at origin, okay, versus destination, and we've got these. And we had Cleveland, Bedford, and York. These folks produce stuff and they ship it out to these different destination locations. And we have a certain amount of supply that we need to ship. And we have a cost or a time unit of some sort. All right. And so we see the supply that's available and then we see the demand. Okay. So we built this matrix and then we have the minimum cost because we're trying to minimize the cost. And this walks us down then to the destinations, okay, and the constraints, and they'll walk us through the formulation of the problem. And again, you know, we're good to go. Now again, I can't emphasize enough that this is just it's just so incredibly versatile, these tools. And let's go over here for a moment, and I want to go to the course. I'm over here in the modules. Let's go to the files, and we'll grab those. Now, a transportation problem can also be one that's constrained, okay, within one building or one location. And so we're moving stuff from workstation to workstation or from assembly station to assembly station. So I'm going to here get the files. And I think that's going to be chapter 6 if I'm not mistaken. And so we'll open it and we'll take a look at it. And here's Foster. Now, one of the reasons I like this textbook and what we do is because it gives us, in a simple model, the kinds of problems that people deal with on a far greater complexity of scale. You say, what are you talking about? Well, you know, we have a supply, all right, and we're sending stuff from Cleveland to Boston, etc. This becomes exceptionally complicated if I have time-sensitive bundles. In other words, I have a set of things that have to be shipped and sent. Say, for example, this overhead in here, there's this little gadget to run the thing. There's the overhead itself. Those need to be bundled together. You can't send one and then send the other, and they've got to be bundled properly so they don't get beaten up and all that stuff. But that makes a double amount of work. Then you got to have the instructions that go with it, all that stuff. We don't think about that because we're just used to buying something and it arrives. We open the box. Here are the components. We might have to do a little bit of work to put something together. We've got the warranty. We've got the instructions and how to use it, that type of thing, and we're good. But that becomes a very complex thing if I have to bundle things. So we see this is a very basic kind of problem that we're working with. All right, but the model is there, and so we have the solution for that. And I'm going to go here and click on data and go to solver again. And here's our objective function, okay? And we want to, in this case, minimize it. And we're going to change those variables. These are changing variables. And then we have the constraints, two sets of constraints, in fact, in terms of origin, destination, and supply, and total. And you can see these down here. You've seen this so many times now. Again, the caveat for us, or the thing we need to think about for us is, all right, where do these data come from? Do they make sense? Okay, can I assume that they work? Or in other words, before I put everything into the blender, is it good? All right, before I put the turkey in the oven, is it ready to go? Or whatever I'm doing, it's the same thing here. If I put in garbage, I'll get garbage out. I'll get a mathematically correct result, but I'll get garbage because it's not logically correct, and that's a whole different thing. Well, let me see what we've got going on other than that, and I want to close this off for just a second. All right, and I'm going to pop back up over here to the modules section. All right. And we'll take a look at that. And just again, to alert everybody what's going on, we'll spend some more time on Wednesday looking at Foster and at Gorman, okay, and then of course DEA. And so we'll get a little bit of a sense of those cases, or a little bit deeper sense. And I've got some finagling with the resources or the parameters on those. And again, just to see what's the change if we alter some of these or alter some of our assumptions. Now, I wanted to show you something that might be kind of not necessarily terribly fun, but this shows you the address of the different airports, okay? And I'm going to download this, and so you can kind of see the flow, all right? And I'm going to save this on my desktop. And this is going to be Leisure Airline Airports desktop. Save it here, okay? And then I'm going to diminish this down, all right? In fact, I can close it off because I've saved it. And I'm going to go over to a website called Easy Map Maker. Now, if you've had some other courses with me, you know that I really encourage you to figure out what's going on with a lot of the geospatial tools that are out there. Now this is primitive compared to what's out there now, okay? So we're going to click Create a Map, okay? And I'm going to get my data, all right? I'm going to go down and open up my Excel file. Let me find it here. There it is. And all I have to do is copy and paste. If I have the entity and then a full address, I'm good to go, and I'm going to copy. Whoop. I'm going to copy those. All right. And then I'm just going to paste it in here. Now there's some other sophisticated ones, and I'm going to click Make a Map. All right. Now again, this is just a simple point map, and it's very, it's very primitive. You can't do much in the way of this uses Google Street. There's not much you can do in the way of layering, okay, like you can with some more sophisticated tools. But if you kind of want to see how they're strung out, there it is, okay? And the folks that do this for a living would be working with a map with all kinds of layers, particularly if it's ground-based transportation, trying to get a handle on, where stuff's under construction, where delays are, etc., and then programming that in. UPS does that now. Before a vehicle leaves, they have their route programmed in, and if there's construction, if there's backup, anything, they know all that, and they have alternative routes. It's just they're gonna get this better and better as we have more ground data flowing up to serves. That is what's going on I-40 out here at 177. So that's something for you to take a look at. Now, the other thing I'd like you to take a look at, and I want just to kind of add some reality to it again, is to come down and take a look at the type of airplane that they're using. Okay, and I went and found that for you. And then I've got some information about seating and how they work. Here's the Boeing 737-400 airliner. It's meant for regional milk runs, basically, between these larger cities or funneling stuff down. There it is. Alaska is obviously, it fits their mode. Gives you an idea of the cockpit and the seating. And probably all of you have flown on a regional airline of some type. But just thought I would give it more of a sense of reality to take a look at the thing and to see. That's why you want to have such a tight control on this, simply because you want as many of those seats filled as you can get. And so I went and found that for you as well. All right. Now, there were some resources that were from last week, and I've got some for this week. This airlines, how they decide what fare you'll pay. How low-cost airlines change the economics of flying. And I think it would be useful for you also to take a look at this on the history of operations research. Well, that pretty much puts us at about 50 minutes, if I'm not mistaken. And I think we've gotten as far as we can. And so when we come back, we'll take a look at, county, the DEA data and development analysis, and then we'll look at Foster and at Gorman as well. And of course, those are due on the 9th. And then on the 9th, you also have Chapter 7. Now, between now and then, I would like you to also do yourself a favor and go take a look at some of this resource on logistics composite modeling and the Humanitarian Logistics Association. I don't know how many times I have students who leave here and say, boy, I'd really like to do something great for the world. And there are many things you can do. But I guarantee you, if you work in this, go work for these people, and they're always looking for someone, you can be really involved in doing some good things for people in terms of getting the medical supplies there in time, getting the cranes there on time, etc. So I'd like you to do that. And then here are some research studies on the data and development analysis. And it's important for you to see this because these are techniques that will be used one way or the other if you work in a large, complex company that's locationally based. Well, that'll be pretty much it. And those of you who join me, thank you so much. Appreciate it. And I'll see everybody Wednesday. So I'm going to stop the share and record this thing. Unless somebody has a question. Anybody out there in the TV land have a question? No? And no one does here? And it's too late to add drop, so we're done. All right, we'll stop the share and we'll stop the recording.